So, good morning. I'm Jorge Gonzalez. I'm the director of TBiomed, which is a non-for-profit business association that we promote digital health across Europe. We are also the coordinator of the In-Demand project. And In-Demand is a project that proposes demand-driven co-creation with public administrations, in particular with healthcare sector, but this can be applied to any other sector. So let me give you some context before I start. So we were participating in projects, the typical European projects where there are a lot of technology push. Okay, there was this Future Internet initiative, I don't know if you are familiar with, where we saw that the companies, they have some technology, and they had to co-create the technology with the healthcare administration, in particular the hospitals, and then we saw that, but the ideas were coming from the industry. It was not coming from the public administration. It was not coming from the buyers. It was not coming from the demand. So what happened was that we organized 7 pilots, and 5 of them were successful. But only after the successful piloting, only half of it, so to say, one project was adopted. And we were very frustrated because we saw that we have spent a lot of time and effort in doing the piloting, and then at the end, there was this valley of death. Nothing happened, okay? So one thing is piloting, and piloting, I think that more or less we all know how to do successful pilots. But the real problem is adoption. I will come to that later. So then, together with our regional healthcare provider, Servicio Murciano de Salud, that's a region in Spain in the southeast, we say, how can we make sure that whatever that we do regarding innovation in public administration, it has more chances to stay, to be adopted, to provide value to the citizens, okay, beyond the pilot phase. So this is what we came with, okay? This is the in-demand model, and I'm going to explain you 2 things. I'm going to explain you first the model, and then how we have implemented it, because these are 2 different things. The model is relatively simple. Okay, so we have a challenger, and in our case, the challenger is a public administration, in particular, a regional healthcare organization, okay, a healthcare provider. Those are the ones that put the need. Those are the ones that know the need. In our case, it's the healthcare professionals that put the need. So the challenger gives the challenge to what we call a funder, okay? Then this funder launches a call where companies, especially small and medium enterprises, they apply for this call, okay? And then once there is a winner for this call, the winner, the solver, the small and medium enterprise, the IT company in our case, then it receives 3 things. 1, it gets money from the funder. The second thing that they get is the most important for me. They get the opportunity to co-create the solution together with the challenger, together with a potential customer, okay? So then they do this co-creation together, and also the solver gets business support. This is similar, you know, the SME instrument from the European Commission. They don't only give money, they also give business support, because they understand that if you are, for example, very technical, you can spend a lot of money in technical things. But if you don't spend money in future commercialization, you can have a great solution that, again, stays in the valley of death because you don't know how to sell it beyond your pilot inside. So the solver gets these 3 things. They get money, they get the opportunity to co-create, and they get the business support. Now, this is the model. And the model can be applied in a lot of different ways. Okay? How we did it in the In-Demand project? We asked the healthcare professionals to propose needs. We didn't go to top management. We went to the people in the field. We went to the people that they are closer to the patients. And for example, I will just tell you this, by the way, we are doing this in Murcia, in Paris, Ile-de-France, and in Oulu, in Finland, okay? But in the particular case of Murcia, and now I'm going to how we implemented this model, it was the first time that we did it, and because we are doing 2 cycles, we have very little time. So in 2 weeks, we had to collect the challenges from the healthcare professionals. And at the beginning, we didn't know how many people will be interested. So we booked a room for 30 people to a workshop to explain the project. Okay, more than 100 people signed to be part of this presentation. So there is a lot of interest in public administration, the entrepreneurs, in order for innovation. That's our experience. It's one of the first learnings that we got. Of course, it is not for everybody, okay? But especially, at least in health, there are a lot of people that they work for public administration that they want to improve things, okay? And that they are willing to put their own time and their own resources after work, because mainly the work that they do in the co-creation is, after the formal work, and they're willing to do that because they're passionate about solving a problem for the end users, in our case, the patients, okay? So we got at the end, we got more than 70 challenges, but we only have capacity to 4. So it was the top management from the healthcare organization that decided the best 4 challenges that they were more aligned with the strategy. Okay, so here the challenger for us has 2 sides. We started a bottom-up process, but then it was top-down because management chose the best 4 challenges. These challenges were sent to the Regional Development Agency, the agency that manages structural funds. What's the beautiful thing about the structural funds? That they are available every year. Okay, if you go to an European project, there is maybe a call 1 year, and maybe you are not successful, so on. With the structural funds, regional structural funds, they are available every year. That means that you can repeat this process every year. Now, these guys launched a call, and then companies submitted. There was an average of 6-7 companies per challenge, okay? Because it was a European project, companies all over all over Europe, they could apply. We do that rigorous selection process, and one solver was selected for each of the calls. These guys receive money with the same conditions that structural funds calls, okay? So we could give them 100%, but we wanted to have the same conditions that the structural funds, the ERDF, so we just gave them 60%. Also because we want companies that they put skin on the game, as the private investor says. We want companies that they don't think this is a service. We want companies that they think this is a new business line for them, that they will commercialize it after the pilot. So then the solver got that money, and they started the co-creation. And for us, this is really, really valuable, especially for small and medium enterprises. Especially for small companies, it's really very hard to interact with public administration. Now, thanks to this program, because they sign a co-creation agreement between the challenger and the solver, they have access not only to the healthcare professionals, but also to the IT department, to legal, to management, etc., etc. That is very difficult to get in standard conditions. And on top of that co-creation, they also got business support. In our case, we delivered 3 kinds of business support. Business modeling, you are familiar with the business model Kanban, lean startup, this kind of thing. Access to private funding, in case that they need private funding to continue the commercialization of the solution, and go-to-market support. They needed to provide a go-to-market commercialization plan after the pilot. So what's the status now? We have completed the first cycle in Murcia, and we have collected the lessons learned, and the lessons learned we have incorporated already in the second cycle. Actually, in my region, in Murcia, yesterday they closed the call for funders. If you go to the project website, you can see the challenges that we have identified, and you can see what is the idea. These challenges can be solved with between 4, we just gave them, the funder gave in the first cycle 40K, 4,000 euros, and in the second cycle, 50,000 euros. And in the first cycle, the co-creation takes 9 months. In the second cycle, 11 months. Okay, so 30,000 for 9 months, 40,000 for 11 months. Why? Because we are mainly asking for digital solutions. Digital is very quick. If you go to a process, an instrument that is, for example, the PCP or the Alliance for Innovation, they usually take several years. because of the characteristics of the process, because of the funnel, right? And also because they involve much more higher quantities. So our point here is like, what happens with the projects that they need less money and less time? What kind of instruments do we have? And we couldn't find relatively good instruments for that, so that's why we came with this idea, okay? In each of the regions participating in the project, we had a challenger, we had a funder, and we have a supporter, and then the solvers apply, okay? And these are the different partners that we have in the project, okay? These are quotes that we go for people participating in the project. I mean, even Costa Isa is a Spanish company with a long tradition. They have more than 20 years in the market. This was the first time that they did such a close interaction with the customer, okay? And here we have also people from, there was the challenger, and this is people from the companies. It's a win-win-win. Everybody wins, okay? The challenger wins because they get a problem solved. The funder, why the funder should be interested in this? The funder, the value proposition for the funder in our case is to say, listen, you have an available budget. What do you think is best? Do you think it's best that you give the money to the companies that they sell you, that they have a good idea and they develop the idea in the lab? Or do you prefer that the idea, the problem is put by the potential customer and the solution is done together with the potential customer? So what we are telling the funder is that you most likely, with the same money, you will have much more impact if you help the buyer and the solver to collaborate, that only the company, you give the money to the company, and they're in the lab, they just think what is the best solution to that particular problem that they think that the buyer has. We think that this is not working. We think that this technology push, especially in areas like healthcare, doesn't work. So that's why we want to bring the demand and the offer together, but starting with the problem identified by the demand, okay? And then making both of them working together. These are more quotes. It's really working very well. I mean, we have a lot of interest from the SMEs. We have a lot of interest also from the challengers because they see that they can solve the problems in an easier way than today. And actually, another thing that we did in the project is to try to create an in-demand community. So our point is like every region in Europe, every country in Europe has structural funds. You can apply this model for yourselves. So we are doing a direct know-how transfer to 12 European regions about this model. So everything that we learned, all the templates, all the contracts, all the criteria, selection criteria, blah, 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 it's going to be public. We have no interest in keeping this to ourselves. We think this is a good instrument, and we want everybody to try it, if you want. So we already have 10, what we call mirror regions, and we have 2 gaps. So if any of you is interested in becoming part of the in-demand community, which is for free, even we will pay for travel expenses to go to a workshop in Brussels to have a personalized training, there are still 2 gaps. Okay, I'm happy to talk with you if you are interested after my presentation. But we already have, for example, there are people from Romania here. We have people from Romania, and there are people all over Europe that they are interested in the model and they want to learn it, to implement it by themselves. You don't need us to implement it. We are here to help with our learnings, but the model is already here. The model is already this. So you don't need us to implement it. Now, we have learned a lot of things during the project, but I tell you what for us is the main, one of the main barriers so far. So I think that we have come up to be very good in terms of piloting. I think that the majority of the organizations, they know how to pilot innovation. The problem is what happens after successful piloting, okay? Because if you are a pilot and it doesn't fail, okay, it's innovation, you have learned, it's okay. But the problem is what happens when the pilot is successful? What we have seen is that most of the times it doesn't get adopted, okay? It stays on the drawer. It stays in the valley of death. And that is a shame, in my opinion, in our opinion. It's a waste. You have invested something, time, effort, and trust of the people that you have worked with, it is successful, and then nothing happens. Next time that you go to the same healthcare professionals, they tell you, no thanks, I don't want to waste my time. You are killing the innovation culture within public administrations if you set up a project that is successful and is not adopted. Because then people say innovation means failure, because even if it is successful, it's a waste of time. So we think that too many successful pilots fail to get adopted, and we call it this beyond pilots. We haven't even heard a term, so we have invented the term. We need to go beyond pilots. We need to, that if a pilot is successful, needs to be adopted. If not, don't start the pilot, or wait till you are mature to get adopted. So we see that there are several reasons for this. I want to share some of these. Probably there are more. But sometimes the pilots are run just by innovation units. But these innovation units are not in charge of adoption. Their business is to have more and more pilots, not that those pilots are adopted. Okay? So the incentives are not aligned. And innovation units, sometimes they don't talk with procurement units or with management. So that's why they just keep on doing pilots, but for no reason. There is much more money to research and innovation than for adoption. Okay? So we are somehow perverting the whole model, the whole mechanism. Sometimes the unmet need is identified by the call, for example, from the European Community. It's not identified by the organization itself. So people, they just get into the project, they get the money, they do the job, but that's not strategic for them. And another thing, and for us is the most important for us, is that there is no scalability mindset. Okay? That the people, what's going to happen after the pilot? Oh, let's see. There is a German, schauen wir mal. We will see. No. What I tell to my companies when they approach to me, we are very close to small and medium enterprises, like, do not start a pilot without knowing two things. What does it mean, success? Okay? So how do you know if the pilot has been successful? Before starting the pilot, so identify the successful criteria and agree what will be the successful criteria. Okay, this parameter goes above this threshold and this. Tell me, what does it mean that the pilot is successful? A second question, what is going to happen if the pilot is successful? If you don't know, wait till you know. Because if you just start the pilot thinking, oh, it's so good, they are going to fall in love with my results. They will immediately buy my outputs as soon as I finish the pilot because this is going to be so good. It's not true. In public administration, they have budgets that are approved annually. So if you are not in the budget of that year, you will not there. And say, oh, okay, we will put you in the budget of next year. When that time happens, you are already forgotten. So that's also one of the reasons why there is not so much adoption. So we think that the next challenge that we have, and this is not part of the initial model of in-demand, it will be part of the future model that we are already thinking and implementing, is that adoption has to be there from the day one, okay? Meaning that the pilot is not just a project, it's just a milestone, okay? The whole project incorporates adoption. And the first milestone is testing, but then immediately has to be a continuation in case that pilot is successful, okay? Because otherwise, if you have to start several projects, the valley of death between the successful pilot and the adoption will kill every option that you have in order to get adopted. Or at least it will be very, very difficult. And we hope that there will be a more systemic way to adoption than today. This is what we are aiming to. Now, here there are some proposals of how can we incentivize adoption. And I tell you especially for you, that if you are national agencies that promote incorporation of adoption, you have a lot of power, even if you don't realize that. I mean, I will give you an example. If you are the funding body, if you are the funder, just to put, by stating, when you go to the challenge, say, listen, I will put the money on the table. It's okay for doing the testing. I will do that. I will trust you. I will give the money for the challenge that you have told me that is important to you. In exchange, what I want is your commitment that if the pilot is successful, you are going to allocate budget to adopt it. Because if not, you are wasting my money and my time and my credibility. So it's very okay that you guys fund innovation against challenges proposed by a healthcare organization, a city hall, I don't know, education, whatever public responsibilities you have at national or regional level. But what I think is fair is to ask these guys that are asking you to use your money to say, okay, I put my money. Do I have your commitment that if this is successful, you are going to launch a procurement to apply for this, okay? Because one thing is the testing, and the testing, in our case, we only have one company, but after the testing, you need to launch a public and open procurement, and you need to fund it. So you can tell them, listen, start putting a reserve of budget just in case this is successful, because this is what I'm going to ask you. And if you don't procure for the challenges that you ask me to put my money on them, don't come back to me, because I don't trust you anymore. So by doing these small things, we will change the culture to try to let's innovate, let's try innovation, let's do pilots to say, no. Are we serious about that? Let's stop gaming with innovation and let's start putting innovation on the table, okay? And for me, gaming is when you do a pilot without knowing what is going to happen next if it is successful. Right, so basically, what we encourage you guys, if you have this capability to influence the public procurement of innovation policies, is that don't assume that only PCP and PPI and AI are the only instruments. There are many other options. The instrument is not an end on itself. What is important is that innovation is incorporated in public administration to serve the public. In our case, the patients, but it can be any other citizen, okay? So there are other ways beyond PCP and PPI. I'm not saying that PCP is bad. What I'm saying is that only adjust to certain specific needs. But there are other needs, like, for example, that can be solved with digital, that taking 3 years is too much. 3 years is a technological cycle. Okay, so whatever you start in year number 1, and by year number 3 or 4 is obsolete. Okay, so there are other ways to do things with the same goal as PCP and PPI. So there are other instruments. Now, my suggestion to you is that maybe in-demand you can think this is a good idea. What about if you devote like a small percentage to investigate this new instrument? Okay, we can tell you it works, but don't take our word. Play with it. Again, we are only devoting 40,000 euros for an implementation. You are not risking too much, and I can tell you is that these kind of instruments, because they are quicker to implement and shorter, they really, for us, what is important is not the project itself, because a project of 40K is not going to change the organization. But what is going to change the culture of the organization, which is for us the most important thing, is to have a lot of small projects that they are run every year. So, for example, in our region now, people are, whenever they think of an idea, okay, I can put this as an in-demand idea next year, in the next call. So it comes. Another good thing that we did in Murcia is that the management gave a certificate to those that put a challenge. Those doctors that put a challenge, they get a certificate that is valid for the professional career, meaning that they will earn more money because they are innovative. So these little things that you can do, they will change the culture of public administration towards innovation. And this is the important thing, the culture. It's not a particular project, no matter how important, how big the project is. It's the culture in the public organization, in the public servants, in the healthcare professionals, in the procurement, in the legal, in the management. If you are able to change that culture, then everything is easier. If you just have one project and it's one shot, it's like nothing. Actually, we, as I said, we are done a PCP, and we are not sure if in Murcia there will be more PCPs in the Servicio Murciano de Salud, because it was so complex. And one of the things that we learned is that at the best, not the best companies get to the end, but the best ones that are able to write to go through all the paperwork, get to the end. Not necessarily the most innovative, okay? So PCP has pros and cons. And this instrument, maybe it has pros and cons. But what I'm trying to do is to open your mind and to try different instruments. So again, I guess I'm good in time. This is what the three main messages that I wanted to share with you is that there is a need to try new instruments beyond PCP, PPI, and Innovation for Innovation, and the Alliance for Innovation. Everything, in our opinion, depends on the need that you have. If you have a big need and you need multiple countries, go for them. But if you have a small need, choose the right instrument for that small need, okay? It's not the other way around. Sometimes we have perversive incentives. Just because there is money, we go to them. It doesn't need to be like that. And then, for us, the real challenge is not co-creation. The real challenge is adoption, okay? And that requires a lot of cultural change. This is us. Thank you very much for your attention.